Bismillahirrahmanirrahim. On behalf of the organizing committee, I invite you all to the plenary session. Chairing this session today is Professor Zia Ul Islam. Sahab, he is a legend in ophthalmology, needs no introduction, an institution in himself. Sir, please come on stage, take your seat. We're honored to have you, sir. The co-chair for the session is Professor Mazhar Qayyum Saab, another big name in ophthalmology, needs no introduction. Sir, please come on stage. So the first speaker today is going to be Professor Sana Ullah Jan. He's a VR surgeon and professor of ophthalmology from Peshawar, and he will be talking about ethical issues in medical writing.
Thank you very much, Dr. Fawad, respectable chair, Professor Zia Ul Islam Saab, and co-chair, Dr. Mazhar Saab. I'm honored and privileged to start this plenary session. With my talk, I'll be talking about ethical issues in medical writing and publication. They are so common, and almost, I would say, with apologies, almost all of us has committed these violations in our professional career, of course, unknowingly, but they were there, and we would like that our younger generation, our younger colleagues and students, they can avoid it. I will be going through brief introduction, then why these ethical issues are there, and then common ethical violations, and then the consequences you have to bear if you commit these violations. Let me start with the quote that people that value their privileges above their principles soon loses both. And one of the scientists was Mr. Fuji from Japan. He was an statist. He wrote more than 200 papers. But ultimately on inquiry, they found that almost 183 of his papers are fabricated, and there was no actual research there. So he set the record of highest number of papers by single authors requiring retraction by different scientific journals. What is ethics? Ethics actually tells you what to do, what is wrong, what is right, and then why it is wrong, why it is right, and then how you should do it, what you should do. These are ethics and values. If you practice these ethics in your medical profession, this is called medical ethics or clinical ethics. Research ethic is little different. It doesn't come under the umbrella of medical ethics because research is a broader term. You can do it in other specialties and other, it may be social, or it may involve animals and other things. Research ethics is a broader term, and publication ethic is one of its subtitles, which is related to publication or medical writing. Then there are some international bodies like Committee of Publication Ethics, International Committee for Medical Journal Editors, and World Association of Medical Editors. They provide code of conduct and best practice guidelines that define publication ethics and advises editors on how to handle cases of research and publication misconducts. Now, ethical issues can occur at different stages of research and publication, and it may be related to researcher, or it may be to reviewers, or whoever is doing the editing or publishing the scientific writings. Related to researcher can have these violations when he's designing the study, when he's retrieving the data, and if he's analyzing the data, these violations can also be there, and sometime when he's writing this manuscript. I will be limiting myself to the ethical violations which are related to researcher because of the time limitation. Research and publication influences clinical practice. And if there are ethical issues, they directly affect the suffering humanity and our patients. Why are these issues? Because the objectives of medical research, they are not in focus when you are doing the research. The objective of research is to create dependable and accurate data, keeping the patient rights intact. If the objectives are not in focus, and if there are personal interests, like if you want to have promotion, you want to have better face value, you are doing research for some award or something else, then these objectives are compromised. And that's why ethical issues. So common ethical issue like conflict of interest, authorship issues, spin, dual submission, publication, plagiarism, data manipulation, salami slide. These are some of the common publication ethical violations are issue. Conflict of interest. There are personal interest and there are research objectives. When they conflict, when you put your personal interest above the research or research interest, then this is called conflict of interest. And you have to disclose all your personal interest or conflict of interest when you are submitting your publication, your research article. Say simple is like if you are writing an article for the sake of promotion from one grade to another, from assistant professor to associate professor. So it's better to disclose that I will be submitting this paper for the purpose of my promotion to the institution. So, and let the readers decide about the study conclusions. Authorship issues, very common. Honorary authors are there, that big names and reputable scientists or researchers' names are put on authors list just to give weight to the publication and articles which some of say pharma people or others are writing. Then there are ghost authors. Somebody else has written or done the job, but you are presenting and without acknowledging his name or putting his name in the authors list. Gift authorship is again very common in colleagues. One will be writing on one topic, another one on, and they would just say, I will put your name in the author list, you put my name. This is happening and it's very common. This is against the publication ethics. So what qualifies you to the authorship? If you are involved in the concept, design, and acquiring and analyzing and interpretation of the data, and then drafting and critically revising the important intellectual content, and then the final approval of this manuscript which is going to be submitted for publication. And then at the end, you agree to be accountable for all aspects of this work. Then if you meet all these 4 criteria, then you can put your name in the authors. If even one criteria is missing, then you are not in the authors list. You may be in the acknowledgement, but not in the author list. Spin is again if you report data results in a way that could distort the interpretation of results and mislead the readers. Most researchers will put positive spin to their negative research. Say if somebody is doing some new technique for surgery, it's natural that he would say this is more effective than what others are doing. So this is positive spin. And this is happening and this is natural. The reasons may be ignorance of scientific issues, unconscious bias, or to find something significant, or intentional deceiving. Then if you submit your article to 2 different journals for publication at the same time, or if they are published, then this is called dual or duplicate publication. This dual submission and duplicate publication both are actually ethically wrong, and because they waste time of editors and reviewers and damages the reputation of journals. Okay. So whatever the words Mrs. Obama used in 2008, Mrs. Trump was using the same words and sentences in 2012. So this is happening everywhere, and people notice that. So sorry because the video was there, but I couldn't run it because of the IT problems. So this is plagiarism. If you are taking someone's work and ideas and passing them as your own, with or without consent. This may be published or unpublished data, printed, electronic, manuscript, or just the idea. If somebody is sitting together and one get the idea that I am going to plan like this, something research, and then he just take that idea and start doing research on that without acknowledging that gentleman. So all forms of plagiarisms are unacceptable. Plagiarism may be direct, which is usual, like copying of words and sentences, paragraphs. Self or auto-plagiarism is also very interesting. Say if you have written many papers on one topic before, so it's very natural when you are writing again on the same topic, you will be using same words and sentences which you have used before. This is natural. So it's advisable not to focus on just one topic and write a lot of publication or articles on the same topic again and again, because this causes self-plagiarism and auto-plagiarism. Accidental plagiarism and other forms of plagiarism may also be there, and all are unacceptable. Then data manipulation, because falsification, say if a student comes to you that he got some data and he would like to publish that, but the number of cases are small. Say there are 30 patients, but just to give weight to that article and increase the face value, you say there were 60 patients, not 30 patients. So this is falsification. And then if you inquire, where did you get this data from? And your junior reply, that actually there was no data. I actually made that data. This is fabrication, more serious crime. And then forgery, copy or imitation of document or signatures. So all these are serious ethical misconducts. Salami slices are a redundant publication. If there is the same study, same experiment, but you take many manuscripts out of same data. Like you have done one study, but you divided it in a minimal publishable unit and published them separately. The patient are the same, everything is same, but you are taking many articles out of their data. That is, again, unethical. So plagiarism, is it serious? Yes, because it is a theft. It is dishonest and you damages the person you are plagiarizing. It inhibits learning, it shadows the sources of idea, it results in bad writing ultimately. Committee of Publication Ethics actually, if you violate these ethics, publication ethics, there may be serious consequences. And it depends on the type of misconduct, if it is major or minor. It may be authors or institution may get blacklisted by the journals, or institution may have to take action. The journals will inform the institution and they may degrade or demote the individual involved in that research. Curious, the wall of shame actually adheres to the Committee of Publication Ethics, and it condemns all form of plagiarism, data falsification, peer review fraud, etc. And they actually highlights the authors and the institution who have committed these ethical violations. I went through this I Googled it, and on the wall of shame, unfortunately, out of 15 names on the wall of shame, 11, 12 was from our beloved Pakistan. So this is a very serious concern. There were few from other countries also. At the end, there is only one thing which is generally safe from plagiarism, and that is self-denial. And if you can do that and stick to that principle, your name will be on the wall of fame, not shame. So thank you very much. Thank you for listening.
Thank you very much, Professor Sana Ullah Jan. So our next speaker is Professor Tayyab Gul Malik. She is Professor of Ophthalmology, Amiruddin Medical College, Lahore, an upcoming force in ophthalmology. She'll be talking about, again, publications You please, madam, you will explain your title of your talk today.
Good evening and Assalamu alaikum. First of all, I would like to thank OSP Federal and OSP Quetta for giving me an opportunity to present my talk on behalf of Pakistan Journal of Ophthalmology. I'll start with this recitation from the Holy Quran. A'udhu billahi minash shaitanir rajeem. Bismillahir Rahmanir Rahim. Indeed, Allah will not change the condition of a people until they change what is in themselves. Sadaqallahul Azim. I declare no conflict of interest. These are my objectives: define, publish, and perish. What are the consequences, and what are the roles of different people to avoid these consequences? Let's see this short video. ठीक है चलें ठीक है So this was an unfortunate incident which occurred in 1992 at Concordia University. There were multiple shootings where a professor of that university shot 4 other professors, and later on it was found that it was due to the conflicts of publication and tenure issues, the pressure which we call as the publish or perish. By definition, publish or perish is a term which is used to describe a pressure to publish research in order to succeed in an academic career. The term was first used in 1928, later in 1932, and then in 1938. And now it is widespread all over the world. It has very bad consequences. It has led to the never-ending struggle to come up with a list of publications in order not to perish. There is a huge burden on the researchers as well as the academic persons. A race has been started to increase the number of publications to an individual's credit, just to increase the size of their CV. Very rightly, it is said that the publications are a currency for academic careers. And the institutions, they were not left behind. The institutions, they started running after funding by all the fair and unfair means. And the scholars who were too busy in teaching and training the students were left behind because they didn't have time to do the research and get their research work published. It also gave rise to the questionable ethics, and fraudulent researches came into being. Many of us know the Piltdown Man story, in which the lower jawbone of an ape was combined with the skull of a fully modern man, and it was described as a missing link in the evolution of humans from apes. And then in 1953, it was discovered that it was only a forgery. So it led to the obsession of quantity rather than the quality. And the increase in the number of publications fueled the demand for new journals. There was a large rise in the number of available scientific journals from 16,000 in 2001 and 23,750 by 2006. It also led to the cropping up and mushrooming up of the predatory journals, which would publish anything just for the sake of money. If you see this graph, from 1997, there is a huge rise in the number of publications, 4,000 times by 2020. As we all know that the quality of a publication is measured by the number of citations and the prestige of the particular journal, but when we probe into this story, we find that only 45% of the articles published in top scientific journals are cited within the first 5 years of publication. And out of those 45, only 42% of the papers, they receive more than one citation, and 5 to 25% of these citations are self-citations. So we have to ask ourselves a question: are we going where we want to go? Is the current research improving patient care, especially in the third world countries? Is it benefiting the community at large? You must have seen there are certain researchers who have dozens of publications in a year. That means they have conceived the idea, submitted protocol, got institutional review board clearance, done the research, wrote the paper, and published it every month. We have to think over it. So we are heading from publish or perish towards publish and perish. Whose responsibility is to correct all this? Authors? Yes. Reviewers? Yes. Editors? Yes. Author's responsibility is to write what is right. Reviewers' responsibility is to highlight if they find any problem, any fraudulent research, they have to highlight that. And what is the responsibility of an editor? The editor's responsibility is not to come under the pressure of authors to publish. They should publish what needs to be published. There's only one solution to all these problems: to take the right path. Only then the sweat, the time, the dedication, that will pay off. This is food for thought for us, and thank you so much.
I would now request the next speaker, Colonel Maeirah Shafique. She is from CMH Abbottabad, and she'll be talking about ophthalmology and Quran. Correction, she's from CMH Jhelum.
Bismillahirrahmanirrahim. ये क्या हुआ? I am Dr. Maeirah Shafique, and I have been posted from CMH Abbottabad to CMH Jhelum. We are all gathered here together in this elite conference of ophthalmology, where we are discussing various aspects, ranging from the anatomy, physiology, various diseases, the breakthroughs that are occurring in ophthalmology every day. I always thought to myself that to touch upon this topic, that how the creator of this master sense mentions it in his manuscript. In this fast-paced world, where Madam mentioned that we are running a race, have you ever stopped and wondered why we are here? I will tell you these days, Marvel series are all the hype amongst the youngsters. You may have also watched some of the characters from them. When the latest Spider-Man movie came out, my children dragged me to the cinema, although I slept through most of it. But when I woke up at the end, I saw that Spider-Man and his friends were being killed, and a condition was put in front of Spider-Man, and it was said to him that if you want them to survive, the condition would be that their memories would be taken away from them. And Spider-Man says, okay, let them live. My friends will find their way back to me. And as I sat in that dark cinema hall, I thought to myself, what of this fictional character in a small movie, in a small world? When Allah was sending us into this world, He took away our memory for a very short period of time. But He knew कि मेरे यार तो मुझे ढूंढ ही लेंगे. In order to help us to find our way back to Him, Allah scattered various ayats in this world. The literal meaning of the word ayat is sign, although it pertains to the verses of the Holy Quran, in which very elaborately Allah has mentioned it and guided the believers. However, the entire universe is full of His ayats. In order to appreciate them, Allah has granted us various senses: sight, smell, touch. Many claim that we are unable to see Allah. The problem lies with this diagram. We think that all these senses connect to the brain. The problem is that in order to find our way back to Allah, we have to see beyond seeing, hear beyond hearing, and feel beyond feeling. As Allah mentions, that this has to be done through the qalb. The heart is the organ through which, in fact, makes use of all the senses and helps us to find our way back and find all the clues. Amongst these senses, sight sits as a king amongst them, one of the most mentioned senses in the Holy Quran. Allah has used this word for Himself. He calls Himself the Al-Basir. Sometimes in this context, He has mentioned Himself in the Quran by the things that can be seen by the human eye. But most of the time, He mentions things which we are not able to see, like what happens in the heart of a mu'min. What happens when a mu'min is sitting alone in a dark room, worshipping, praying, and connecting to his Lord. Allah says in the Quran that vision comprehends Him not, but He comprehends all vision. My presentation today is dedicated to this very close Sahabi of the Prophet Muhammad sallallahu alaihi wasallam, Abdullah ibn Maktoum. This Sahabi, this companion, was amongst the very first Meccans to accept Islam. He was congenitally blind, and when he came to the Prophet sallallahu alaihi wasallam and was not given the due attention, Allah minded it, and in his honor, Surah Abasa was revealed. As it is mentioned in it, the Prophet frowned and turned away because there came to him the blind man interrupting. But what would make you perceive, O Muhammad, that perhaps he might be purified or be reminded, and the remembrance would benefit him. He later came to become the second Muazzin after Hazrat Bilal in Medina. And would you believe it that he, in the end, embraced martyrdom during active jihad as being the flag bearer from the Muslim army. When we entered into the field of ophthalmology, we heard that when there is a curtain falling in front of the eye, it is most of the time synonymous with the retinal detachment. You lose your vision suddenly. What if there was no anatomical defect and still there was a curtain in front of our eyes? As Allah mentions in His book, truly it is not their eyes that are blind, but their hearts which are in their chests. This book of mine is a very humble effort to collect all the verses of the Holy Quran pertaining to ophthalmology. It has been written with the constant support of my teacher, Brigadier Amjad Akram, and the complete support of my parents. The book is divided into two portions. The first is a tabular portion in which, with an eagle's eye view, you can just see where ophthalmology has been mentioned in Surah Baqarah and the upcoming surahs. And the second portion, according to my understanding, I have divided into different chapters. This book has been written as a Sadqa Jariyah. The copies of the books are available at the back on the table. Anybody who is interested in reading it, most welcome to take it from there. It is my habit to, because we are so busy in the ORs, in the OPDs, that in the OR, the trainee reads 1 or 2 pages of this book as we are doing the surgery. And we contemplate upon different verses of Allah, how Allah has mentioned the eyes, whether in respect to seeing, whether the lack of vision, blindness, some other uses of the eyes like seeing in a dream or lowering your gaze, anything that we found was pertaining to ophthalmology purely in Arabic verses, not in the English translation versions. I would like to end my presentation with this ayah of the Surah Baqarah. خَتَمَ اللَّهُ عَلَىٰ قُلُوبِهِمْ وَعَلَىٰ سَمْعِهِمْ وَعَلَىٰ أَبْصَارِهِمْ غِشَاوَةٌ وَلَهُمْ عَذَابٌ عَظِيمٌ. Allah has sealed their hearing and their hearts, and on their eyes there is a covering. Theirs will be an awful doom. I pray that we are able to use our ophthalmology in this world and the next so that we can benefit ourselves as well as our patients and others, and may we not be raised as the people who will be raised on the day of judgment and will say, Ya Allah, why are we raised blind today when we had sight in this world? I thank you all for your patient listening.
Coming to the next speaker, Rabail Peerzada. She is the Chief Coordinator, Pakistan Foundation Finding Blindness.
Bismillahirrahmanirrahim. Good evening and assalamu alaikum to everyone. سب سے پہلے میں شکریہ ادا کرنا چاہوں گی کرنل شہزاد اور آنریبل پینلسٹ اینڈ ہر ٹیم جنہوں نے ہمیں یہاں پہ انوائٹ کیا اور ہمیں موقع دیا کہ ہم اپنے بارے میں بتا سکیں. سو بلائنڈنیس ہے کیا؟ اس کو سمجھنے کے لیے میں چاہوں گی کہ آپ لوگ 10 سیکنڈ کے لیے جو ہے اپنی آنکھیں بند کریں, جسٹ فار 10 سیکنڈ. اوکے, سو ہاؤ یو ور فیلنگ, آپ کیا فیل کر رہے تھے؟ ہر طرف ڈارکنیس ہی ڈارکنیس تھی نا. میں اور میرے بہت سے ایسے ساتھی جو 24 گھنٹے اسی اندھیرے کے ساتھ ہم لوگ سفر کرتے ہیں. اگر میں اپنی بات کروں تو مجھے سم ٹائم ایسا محسوس ہوتا ہے دیٹ آئی لیو ان اے گریو, میں کسی قبر میں ہوں اور اس میں چل پھر رہی ہوں. سو ہمارا جو ادارہ ہے, جیسا کہ ہم سب جانتے ہیں کہ ہمارے ملک میں بلائنڈنیس جو ہے بہت تیزی سے جو ہے وہ پھیل رہی ہے. میں بات کروں گی 1988 کی, جب ہمارا ادارہ جو ہے ماض وجود میں آیا. اس کو بنانے کے پیچھے مین مقصد یہ تھا کہ جو ہمارے فاؤنڈرز تھے, مسٹر ظہیر خالد جو چارٹرڈ اکاؤنٹنٹ تھے, اینڈ ڈاکٹر سلمہ مقبول, شی ور آلسو ڈاکٹر, اور سڈن آر پی کی وجہ سے ان دونوں نے اپنی نگاہ کھو دی. اس وقت چیئرمین سر عبداللہ یوسف بھی ہمارے ساتھ تھے, جو آج بھی کرنٹ ہمارے چیئرمین ہیں. اس وقت آج سے 35 سال پہلے کی بات کریں تو یہ کہا جاتا تھا کہ جی آپ کی نگاہ چلی گئی ہے, تو پوچھا جاتا تھا کہ اب ہم کیا کریں؟ وہ کہتے ہیں اللہ کی مرضی. am I right؟ ایسے ہی ہوتا تھا نا کہ آپ مطلب کوشش کریں کہ بس آپ کھا پی لیں, قرآن مجید حفظ کر لیں, اینڈ دیٹس اٹ. لیکن اس وقت ان 2 عظیم ہستیوں نے یہ سوچا کہ کیوں نہ کچھ ایک ایسا ادارہ بنایا جائے جس کی مدد سے کہ جتنے بھی نابینا افراد ہیں ان کو ایک زندگی مل سکے. میرے جیسے لوگ جو بعد میں نابینا ہو جاتے ہیں کسی حادثے کی وجہ سے, کسی بیماری کی وجہ سے. سو انہی چیزوں کو لیتے ہوئے سب سے پہلے ہم نے ریسرچ شروع کی, بلڈ سیمپلنگ لی, اور بہت سارے نیشنل انٹرنیشنل ہم نے ریسرچز پہ کام کیا. الحمدللہ ہم 1990 میں ریٹنا انٹرنیشنل سے بھی ہم کنیکٹ ہوئے, جس کا مین مقصد یہی ہے کہ بلائنڈنیس تیزی سے جو بڑھ رہی ہے تو پی ایف اے بھی اس میں اپنا کیا کردار ادا کر سکتا ہے. سو جیسا کہ آپ تمام ڈاکٹرز یہاں پہ موجود ہیں, اور آپ ڈاکٹرز جو ہیں نیشن کا ایک بہت ہی اسٹرانگ پلر ہیں, کیونکہ شاید اگر ڈاکٹرز نہ ہوں تو آئی ڈونٹ تھنک سو کہ کوئی بھی شخص جو ہے اس دنیا میں جو ہے وہ صحت مند ہوگا. دیٹ آل کریڈٹ گوز ٹو یو. بٹ ایک پرابلم یہ آتا تھا کہ اب ہم بلائنڈ ہو چکے ہیں تو ہم جائیں گے کیا, ہم پڑھیں گے کیسے؟ اگر میں اپنی بات کروں, when I was 12 years old, میرے سر پہ چوٹ لگی and within a 5 minutes I lost my eyes. میری دنیا اندھیری ہو چکی تھی, کوئی نہیں تھا مجھے یہ بتانے والا کہ میں کہاں جاؤں. تو پاکستان فاؤنڈیشن فائٹنگ بلائنڈنس پاکستان کا سب سے بڑا وہ ادارہ ہے جو اویئرنیس ریز کرتا ہے, اور 1995 میں میڈم سائمہ نیاز جو کہ اللہ کو پیاری ہو چکی ہیں, انہوں نے پاکستان کی ہسٹری میں سب سے پہلے آڈیو لائبریری کا آغاز کیا. یعنی کہ 2 قسم کے نابینا جو ہم سب دیکھتے ہیں, ایک وہ جو بائی برتھ بلائنڈ ہوتے ہیں جو بریل سے پڑھ لکھ لیتے ہیں, ایک ہم جیسے بلائنڈ جو کسی حادثے میں کسی بیماری میں اپنی نگاہ گنوا دیتے ہیں. ہمارا بھی اتنا ہی رائٹ ہے اس سوسائٹی میں موو کرنے کا جتنا ایک عام انسان کا ہے. سو اسی چیز کو لیتے ہوئے 5th ٹل ماسٹرس تک ہم فری ایجوکیشن پرووائڈ کرتے ہیں آل اوور دا کنٹری. نہ کہ جسٹ ایجوکیشن بلکہ ساتھ ہی ساتھ ہم کام کرتے ہیں پلیئر لسننگس پہ, آتھرس پہ, تاکہ بلائنڈ لوگ جو ہیں وہ بھی ایجوکیشن حاصل کریں اور اپنی زندگی کو بہتر سے بہترین بنائیں. ایسی بہت ساری مثالیں آپ کے سامنے ہیں کہ کچھ بلائنڈ جج بن چکے ہیں, چارٹرڈ اکاؤنٹنٹ ہیں, CSS ہے اور بہت کچھ. سو ویل اسی طرح سے ہمارا سفر آگے چلتا گیا. ٹیکنالوجی نے بہت تیزی سے جو ہے وہ گرو کیا اور بہت تیزی سے سبھی جو ہے وہ کاغذات سے نکل کے موبائل کی دنیا میں آ گئے. تو اسی لیے 2006 میں پاکستان فاؤنڈیشن فائٹنگ بلائنڈنس نے فری انٹرنیٹ کیفے کا آغاز کیا, اور الحمدللہ ہم نے پورے پاکستان میں 19 IT لیب جو ہیں وہ اسٹیبلش کیے ہیں. اور یہ فری انٹرنیٹ کیفے ہیں جس میں نابینا افراد آتے ہیں جو اسکرین ریڈر کی مدد سے اپنی انفارمیشن ٹیکنالوجی لیتے ہیں, اپنی ایجوکیشن, اپنی پرسنل, اپنی پروفیشنل لائف کو بہتر کرتے ہیں. ویل آپ لوگوں کے سامنے میں ہوں, am I right؟ سب سے پہلی چیز یہ ہے کہ اگر میں آپ کے آنکھوں پہ پٹی باندھ دوں تو کیا آپ خود سے ڈریس اپ ہو سکتے ہیں؟ نہیں نا. خود سے اپنے کلر چوز کر سکتے ہیں, خود سے چل سکتے ہیں. تو ایسی بہت ساری چیزیں ہوتی ہیں. جب بھی کوئی شخص بلائنڈ ہوتا ہے سب سے پہلے وہ چلنا بھول جاتا ہے, وہ کھانا پینا بھول جاتا ہے, وہ دیکھنا بھول جاتا ہے, وہ اس کے لیے دنیا اندھیری ہو چکی ہوتی ہے. تو اسی لیے ہم نے کیپیسٹی بلڈنگ ٹریننگ جو ہے ان کا آغاز کیا, جس میں پرسنالٹی ڈیولپمنٹ تاکہ وہ اپنے کو آپ کو اچھے سے کیری کر سکیں, انڈیپینڈنٹ کوکنگ اسکلس تاکہ وہ اپنے گھر کو بھی مینیج کر سکیں, لائیولیہڈ آئیڈیاز تاکہ وہ شارٹ اس میں جو ہے اپنے بزنس کر سکیں, نہ کہ صرف یہ سیلف ڈیفینس, تکوینڈو آرٹ اور موبلٹی جیسی بہت ساری ٹریننگز جو ہیں ہمارے ادارے میں بالکل فری آف کاسٹ کروائی جاتی ہیں آل اوور دا کنٹری. یہ تمام ٹریننگ فزیکل اینڈ آن لائن پرپز پہ کروائی جاتی ہیں. ویل یہاں پہ صرف ہم نے یہ نہیں کرتے کہ اسٹوڈنٹس کو ایجوکیشن دی اور کہا کہ جی ہمارا کام تو ختم ہو گیا, نیور ایور. یہاں پہ PFA بھی ان کے لیے ایک اہم کام ادا کرتا ہے کہ ان بچوں کو ہم لوگ انٹرنشپ کرواتے ہیں, 3 months کی پیڈ انٹرنشپ, جس میں ہم ان کو پنجاب کالج, عسکری بینک اور اس طرح کے بیکن ہاؤسز جیسی جگہوں پہ انٹرنشپ کرواتے ہیں تاکہ لوگوں کو یہ احساس ہو سکے کہ ہم بھی رسپیکٹیبل شہری ہیں, ہمارا بھی اتنا ہی رائٹ ہے جیسے کہ ایک عام پرسن کا ہے. ویل اگر میں آپ کو اویئرنیس کی بات کروں تو ہمارے ہاں اویئرنیس اتنی ہے کہ جب میں بیکن ہاؤس میں پڑھانے کے لیے گئی تو مجھے پہلا سوال کیا کیا گیا, آئی ہیو ڈن ماسٹرز ان انگلش لٹریچر اینڈ لنگوسٹکس, اینڈ شی سیڈ کہ اچھا نابینا لوگ بھی پڑھتے ہیں, ہم تو سمجھے صرف وہ بھیک مانگتے ہیں. سو دیٹ واز دا فرسٹ کمپلیمنٹ جو مجھے بیکن ہاؤس میں میرے پہلے دن ملا. تو اسی اویئرنیس کو ہم لوگ ریز کرتے ہیں, ہم اپنے اسٹوڈنٹس کو بزنس کرنا سکھاتے ہیں, ڈفرینٹ کالجز سے, یونیورسٹی سے آپ جیسے اچھے لوگوں کے ساتھ کنیکٹ ہوتے ہیں اور زیادہ سے زیادہ ہم اویئرنیس ریز کرتے ہیں تاکہ لوگوں کو یہ پتہ چل سکے کہ وی کین ڈو ایچ اینڈ ایوری تھنگ بیکاز نتھنگ از امپاسبل ان دس ورلڈ, کاز امپاسبل سیز دیٹ آئی ایم پاسبل. تو لوگوں کی زندگی کو خوبصورت بنانے کے لیے ہم نہ کہ جسٹ یہ کرتے ہیں بلکہ ان کو ہم ہیلتھی ایکٹیویٹیز بھی کرواتے ہیں. ہائکنگ ہو گئی, اس کے علاوہ کلائمبنگ ہو گئی, بوٹنگ ہے, فش ہنٹنگ ہے, اور ایسی بہت ساری ایکٹیویٹی ہیں جس میں وہ کہیں پہ بھی شانہ بشانہ جو ہے لوگوں کے ساتھ مل کے کام کر سکیں. سو ویل میں کل پوری دنیا میں وائٹ چین سیفٹی ڈے یعنی کہ جو میری شہری ہے اس کا عالمی دن منایا جا رہا ہے, جس کا مین مقصد یہ ہے کہ وائٹ چین اٹس ناٹ اے سمبل آف سمپتھی, इट्स अ सिंबल ऑफ एन एम्पैथी. आप हमें देख के अफसोस मत कीजिए, हमें अप्रिशिएट कीजिए कि हम लोग भी भरपूर कोशिश कर रहे हैं कि शाना बशाना आप तमाम लोगों के साथ हम चल सकें. सो वेल, जैसा कि मैंने पहले भी कहा कि डॉक्टर्स इज़ अ मेन पिलर ऑफ एनी नेशन, कि अगर आप लोग ना होते तो शायद आज कोई भी सेहतमंद इंसान ना होता. तो आप सबसे मैं ये रिक्वेस्ट करूँगी कि वाइट केन सेफ्टी डे के मौके पे यह हमारी तरफ से एक छोटी सी रिक्वेस्ट है कि आपके पास कोई भी ऐसा विजुअली चैलेंज आए या कोई भी सराउंडिंग में हो, उनको प्लीज़ हमारा नंबर शेयर करें. ये हमारा वादा है कि हम उनकी ज़िंदगी खूबसूरत बनाएंगे, क्योंकि हमारा ये मानना है कि कोई भी डिसेबिलिटी इंसान के जिस्म में नहीं होती, इंसान के दिमाग में होती है. उसको निकाल के बाहर फेंक दें तो ज़िंदगी बहुत खूबसूरत है, और ज़िंदगी गुजारने के लिए आँखों की नहीं, खूबसूरत दिल की ज़रूरत होती है. थैंक यू एवरीवन.
Thank you very much, Rabail Peerzada. I think the applause gives you an idea how much everybody appreciated your talk. So next, coming to the next talk, it's by the chair of the session himself, Professor Zia Ul Islam. He'll be talking about medical ethics.
Bismillah ar-Rahman ar-Rahim. I would just really, whatever the lady said, when I was the principal of Mazhar Medical College, I recruited a young boy, and he has done some sort of training in one of the blind school, and I recruited him as a telephone operator for the medical college, and he's still there, and you wouldn't believe it that he is the best telephone operator. He remembers in thousands some of the numbers, and you just call him, they just ring the person and he will just ring. So I think it's really, if we train people and give them the opportunity, so they can perform better. Coming to my topics, I would like to congratulate Colonel Shahzad and his team that in spite of problems and difficulty previously, they could arrange the meetings under the leadership of Professor Mazhar. So I would like to congratulate you. Now my topic is medical ethics, because I had presentation nationally, internationally. Now it's the time that we can give some advice to some of our colleagues. So that's why I choose this topic as medical, ladies and gentlemen, as we see advancement in medical profession, particularly in ophthalmology, question of medical ethics are coming up more and more in our society. We may have our opinion about right and wrong, but the field of medical ethics is actually one that has body of research and accepted practice. It is something all of us should know about it. Now, from religious perspective, ethics as moral philosophy has been derived from the divine teaching of the Prophet, peace be upon him. The several Quranic verses directly emphasize the importance of ethical framework for human society in general and individual in particular. Quran में है वमन अहया फकन्नमा अहया अन्नास जमीआ, and whoever saved a life shall be regarded as if he has given life to all human beings. Now modern medical ethics were laid down when certain basic principles were evolved in 19th century. The American Medical Association adopted its first code of ethics in 1847. Later in 1960 and 1970, medical ethics went to a dramatic shift and largely reconfigured into bioethics. Now, bioethics refer to the moral issues and problems that have arisen as a result of modern medicine and medical research, which can be personal, organizational, or institutional. Now, regarding medieval and early modern period, the field is adapted to Muslim medicine and its proponents. The first book dedicated to medical ethics was written by Ishaq bin al-Rehan, named as Conduct of Physician. Now, in recent past, much work has been done to rectify the ethical failing in medical practice, while every emerging situation being examined with ethical framework. Now, this framework is based on four basic principles. The first one is beneficence, do what is best for the patient. principle is based upon the objective assessment of the doctor and what they feel is best for their patient, which may be in conflict with patient's own view. The second one is autonomy. A patient has got a right to decide on their treatment. This simply means that an informed, competent adult patient can refuse or accept treatment, medical or surgical, according to their wish, because they are free and rational. Their decision shall be respected even if these decisions are not in the best interest of the patient. And the example that you see a lot of patients in glaucoma and diabetes, they don't follow they will follow their own rule. Saying that we must counsel our patient about the disease, treatment and advantages, disadvantages of the management. Like for example, if a patient of glaucoma comes to you, now you should explain that this medicine you have to continue just like hypertension and diabetes. It's not that once you have put your drops. So it is very important to counsel your patient, particularly those who are illiterate. The issue of autonomy becomes much more complicated for children in a situation of adult who is not able to decide things for himself. The principle of autonomy applies to the wishes of the family for the child. Now the next one is the non-maleficent. Do not harm your patient. Now this seems obvious. Why should we do anything to harm our patient? But let's consider the example of certain investigation and treatment which possibly could, for example, toxic effect of medicine, radiation and surgical complication. Thereafter, we must weigh a possible treatment decision within risk of versus benefit or beneficent versus maleficent. The last one is justice. Be fair to everyone. The principle of medical ethics, justice, means that you should treat every patient the same, irrespective of age, race, sex, personality, income, insurance status. Now, another important aspect of the medical ethics is the confidentiality and privacy. When a patient discloses information to their doctor, the doctor pledges not to discuss this information to others. Maintain doctor-patient relationship and trust may only be broken under certain circumstances, like within healthcare team and in case of insurance, public interest, or to statutory bodies like courts. Now, another aspect of medical ethics is consent. Gaining consent is the ethical and legal requirement of doctors for a treatment or investigation. Written consent must legally be verified. Now, consent in children is very important. Age 18 years, patient is legally considered an adult. For children aged less than 18 years, patient or legal guardians have the right to provide consent. Lastly, the treatment management of a patient shall be resources, allocation, quality, and need-based models. Now, doctors can be a friend, doctors can be an advisor, doctor can be a father, and doctor can be an expert. Now, medical ethics and research, Professor Sana Ullah Jan and others, they have discussed in detail, so I wouldn't go into that. Medical ethics is a very vast subject which is not possible to be explained in a short time. I have just highlighted the basic principle along with some practical tips to be considered in your professional life. I would recommend everybody of us to be a promoter of ethics in our professional life. Thank you very much.
Thank you very much, sir. Such talks are actually, we're in dire need of such talks. आजकल की तेज़ दौड़ जो लगी हुई है हसल बसल उसमें we need constant reminders like this, medical ethics के principles के बारे में. So we're coming to the last talk now, which is by Professor Mehfooz Hussain, who is from Jinnah Medical College, Peshawar. He'll be talking about the HOTA Act.
ये सेव किया था ना, डेस्कटॉप यही है ना.
After this talk, if there are any comments, the House will be open for comments or any questions. And after that, there will be a shield distribution ceremony, and then there will be an announcement. So I would like you to bear with us for a little while.
Bismillah ar-Rahman ar-Rahim. Thank you very much for inviting me for this plenary session. And the reason for that was to aware everyone what's HOOTA Act and what should be done to do the amendments in the HOOTA Act. HOOTA Act, right, it was passed in 2010. It was passed by the federal government, but then because of the amendments in the constitution, now it's the prerogative of the provinces to make their own acts. At the moment, what has happened, that the central act, or the act by the federal government, has been copied by the KPK, Sindh government, Punjab government, and Balochistan government. So what they have done is that the HOOTA is changed into Kahuta for the KPK, Pahuta for the Punjab, and Sahuta for the Sindh. But everything is the same in this. So whatever the federal government has done, and the problem is, the act was made by a kidney transplant surgeon. So he thought that all the transplants are being done in the Pakistan are kidney transplants. Actually, most transplants done are the cornea transplants, and they didn't think about that. We had many meetings with the federal minister in the previous governments, and now we are having meetings with the federal minister of this government, and we are having meetings with the KPK government. So the idea of this talk was to make everyone aware that you have to do this thing and replicate this in your province. It's not Human Organ Transplant Act, it's Human Organ and Tissue Act. So that's I want you to just and then it extends to the whole Pakistan. I will just explain few things. What is regulatory body and what are the problems with that? What is a monitoring authority? What is evaluation committee? Who can donate? How can donate, and these things. So I'll just do by one, and I'll let you know what are the problem with those sections and how we need to change them. Now, first of all is the regulatory committee. Regulatory committee is being appointed by the government, and the health minister is the head of it. Then it has got the secretary health and the other people. Now the problem with that is the secretary health and minister of health have no interest in organ transplantation. They don't have any idea what is doing. So they don't do any meetings at all. In KPK at one time for 2.5 years, they didn't do a meeting. So what I will suggest at the end is to change the regulatory committee to be more practical and more approachable. Now this committee is too big, so that needs to be changed. I will give suggestions at the end, and then you can copy that for your province. Now what's monitoring committee? Monitoring committee is additional secretary health, recognized surgical transplant specialist, recognized medical transplant specialist, and gastroenterologist, hepatologist. Because it was made by a kidney transplant and a liver transplant surgeon, so everywhere there's a gastroenterologist, intensivist, anesthetist, all those things. The work of the monitoring committees to monitor the transplant centers, inspect the recognized institutions, and inspect those institutions we want to be recognized. The next is the evaluation committee. Now, regulatory committee appoints the evaluation committee, and look at the evaluation committee. Sorry, it's back. It's too big. What we suggest, that there should be a smaller evaluation committee of institute. So only the ophthalmologist of the hospital and another ophthalmologist should consist of a evaluation committee. At the moment, the evaluation committee is too big. By the time the cornea comes and you go to the evaluation committee, the time has passed and the cornea has been destroyed. So this thing needs to be changed, because every donor and every recipient has to be approved by the evaluation committee. If your donor and your recipient has not been approved by the evaluation committee, if the patient goes to the court, you won't be able to defend yourself. So it's not a joke, because when something goes into the court, the judge doesn't think what you have done something for the benefit of the patient. They go by the law, and the law is if the evaluation committee hasn't approved the donor and the recipient, you cannot transplant, and that doesn't happen anywhere in Pakistan. Then who can donate? Donor means a person donating any part of the body or organ, and what it means, even if you are donating a hair or a conjunctiva or a stem cell or amniotic membrane, everything is a tissue and cell. So you have to take permission from the evaluation committee. Well, this cannot be possible in the ophthalmology, because and it happens in other places as well. Like you do hair transplant, you do dental transplant, you do other transplants. So you have to get the approval because it is a human organ and tissue act. It applies to everyone. Donation by the living person. We don't do donation by the living person, but sometimes we do for the stem cell transplant. Doesn't happen very frequently, but even if you're doing a stem cell transplant, you have to get approval from the evaluation committee, which is too big. Then who can donate? Anyone 18 in person, I'll leave this one. Now, who can be transplanted? A recognized transplant surgeon. What is a recognized transplant surgeon? A surgeon who has been approved by the regulatory committee and by the inspection committee. Now, that's a very long procedure. I know the colleagues in Pakistan who have been waiting for months and years to be approved as a surgeon. Unless you are not approved, unless your institute is not approved, you cannot do the transplant surgery. And then what happens? If you get approved, you have to get a reapproval every year. Now, the committee doesn't meet every 2.5 years or 2 years, so you cannot get the approval every year. So if you have got approval on the 1st of January 2022, you have to be reapproved on 1st of January 2023. But the evaluation committee doesn't come to you that quickly, and it's a very cumbersome procedure. So that needs to be changed. Now, where can be transplanted? Only in the recognized institute. Our suggestion is that any hospital who has got the facilities of operating theater, like for the cataract surgery, should be allowed to do the transplant surgery, and I will give you in the suggestions how that can be done. Who cannot be transplanted? Donation is not permissible from Pakistani citizens to the other countries, and you cannot transplant a non-Pakistani citizen. Like in KPK, half of our patients are from Afghanistan. So according to the Act, I cannot transplant a non-Pakistani citizen, and that would be illegal. So that needs to be changed as well, that there should be provision for that. Then what are the purpose? In the Act, no organ or tissue removal except for therapeutic purpose. It's in every HUTA Act. Now, if this is like this, you cannot do training on the corneas, you cannot do wet labs in Pakistan, you cannot train someone. So there should be provision that if the tissue is research grade, like research grade is that cornea which cannot be transplanted, that should be allowed for the research purposes, and that should be allowed for the training purposes. Now, punishment is okay. It is like if you don't comply with the HUTA Act, the punishment is 3 years removal from the PMDC without any warning. So first time you do something against the Act, your name can be removed or will be removed if someone goes against you in the court, and that will be 3 years from the PMDC or PMC, whatever it is. Now, the suggestion is there should be separate section regarding ophthalmology or regarding eye in the HUTA Act. So you need to convince your own provincial government for that. And there should be a provision for the transplant of amniotic membrane and facialita and other things, because at the moment you have to get approval from the evaluation committee. Then we suggest that every hospital who has got a big theater and who has got the facilities for the cataract surgery, retina surgery, cornea surgery, should be given approval to do the corneal transplant surgery. Same is any surgeon who has done FCPS or equivalent and has been trained in the transplant surgery should be allowed to do the transplant surgery. Yes, every surgery should be notified to the government. All the records should be notified to the government. And the one thing that is missing in the Act, there is no provision in the Act that you can import a tissue or an organ. Now, 99% of your corneas are coming from abroad. There is no provision in the Act that you can import and transplant a tissue into a Pakistani citizen. So there should be provision that we should be able to import tissue from other countries, as we are doing at the moment. At the moment, if someone goes against the court that There's no provision in the Act that you could have imported the tissue from America, Sri Lanka. Why you have done that? You don't have any ground to stand. So what I suggest that you need to approach your own health department of your province, and we are doing it at the federal level with the help of OSP Center and with the KPK. You need to approach Punjab, Sindh and Balochistan to change the things accordingly, to make it easy. Make it easy so that the make life easy for the doctors and for the patients. Thank you very much for your time.
I would request.
Now, Professor Madar Ishaq, being the president, when I was the president, the HUTA here in federal government, the president of Ophthalmological Society was a member. And I attended that meeting, that was the first time. And I told them that whatever you have done, this is only for the kidneys, it doesn't suit the cornea. And they said that we'll just bring some changes. Have you attended any meeting?
There's never been any meeting. At least at the federal level, it has never been called. Yes, we have got a, in Punjab, Lahore is quite active. They have got a director of HOTA and everything is going on over there. But Professor Nadeem, if he's around, he did a lot of work over there. And he was able to convince them that sclera and this tarsus-plate and everything is allowed. I'm not sure whether it has become a part of the amendment or not, but in principle they had agreed at that time. So if we can ask Professor, because that is about talking about Punjab one. Federal is not come up yet, and I personally being in my clinic, private clinic, we have asked the Punjab HOTA, and they came and checked and they've approved my clinic. It took about 1 year for them, but otherwise they're not very much pushed about in our part.
Do you pay annual registration?
Yes, we do.
Yes. Okay, that's good.
So, any other comments or questions related to the other talks?
I will just comment on it. You know, as regarding the Punjab and KPK, we have made the rules, and according to the rules, we have reduced the number of people in evaluation committee. But the problem is, if you talk to a solicitor or a barrister, they will say, doesn't matter what rules you make, if it is against the act, it's not acceptable. So problem will be when a patient goes to the court, then you won't be able to stand or you won't be able to defend yourself. So that's the problem. That's why we need to change the act. In the Punjab, they have changed the rules. In KPK, we have changed the rules, but not the act. So we need to change the act so that the rules can be changed as well.
So a lot of advocacy is needed at the political level as well.
A word of caution about informed consent. The very fact that you take the consent from the patient, it does not spare you from litigation in the court, because the court does not accept that you have got the blank protection against any outcome of your procedure. So as long as it is not according to the science, you will be prosecuted, even if the person has given the consent that, you know, he is allowed to do this, I will not take him to the court. You can write anything, but it does not protect you. Why I am saying that? Because I was taken to court. So I have been through it, and that was also taken to court on ethical issue. That some of my colleagues know that I compiled and authored the Code of Ethics for Ophthalmological Society in 1996. And we had decided that if somebody has unethical practice, how to deal with it. So it was decided that in the conference we will mention that this and this unethical practice has been carried out, and the guilty person will know himself. So I pointed out few people, and they retaliated, and I ended up in the High Court on a false case, you see, which I eventually won after 2-3 years of litigation. But here is that how we implement the ethics in Pakistan. That is the next problem. Thank you.
Thank you, sir. Professor Tayyab.
Thank you. I'm Dr. Tayyab. Very interesting talks from all the speakers. I will. Professor Sana and Professor Gul, especially talked about the ethical research and all that. But at the end of the day, I think when we hold such sessions again, we will also like to hear what is the solution. That's very important. We have been made aware of the problem. Yes, it is a problem. I know certain very leading authors of the leading institutions of the world who have published over 60 publications in a year. And as Professor Gul has said, it's difficult to publish 12 in a year. How it was possible? So there are a lot of ethical issues, and there is a pressure, too much pressure for career and everything. But certainly, how can we, at the end of the day, our objective is how to improve the quality of care for the patient. And how can we do that? And one of my opinion is that our students of ophthalmology, those who are residents or doing their post-graduation, we should concentrate on evidence-based medicine. And the journal club is one of the very important tools where we can teach them how to read the article, how to find out what is the conflict of interest, and how far this research meets the ethical practices. So that's how they will just practice those clinical outcomes of that research. If they follow it blindly, they will just start following the wrong type of practices. So that's why this is one of my suggestions. I have got time?
Sure, sir.
Secondly, regarding just Pakistan Foundation Fighting Blindness, and just to thank you very much, Ms. Peerzada. You made an excellent presentation of your organization. I just, as a member of the National Committee of Eye Health, I also let me tell you that National Committee of Eye Health is doing a lot of things about inclusive practices all over, in all the hospitals, as well as in the educational institutions. And I hope that you will also be in touch with National Committee of Eye Health for knowing about what are the various inclusive measures we are taking about. And lastly, regarding the question, this Professor Mehfooz talked about the cornea grafting and HOTA, etc. I think the legislators should also be approached, and our policy makers, they should be approached, and they should be told about. And my suggestion is, Dr. Mehfooz, have you had any idea of what other countries of the region are doing about this? What are their laws? For example, we are a bit new in introducing HOTA. So India, Sri Lanka, and other.
In some of the countries who are doing very well in the transplant, nothing happens in the government sector. Everything is done by the eye banks. They do everything according to legal, and they report it, and they document everything. But once the government comes into the action, secretary changes, and you don't know who the next secretary will be. Minister changes, you don't know who the next minister will be. So it should be. And the other thing is, what I didn't mention in the talk is that it is the government, central government, who has to maintain all the record of the donors and recipients. If the central government has to do that, what the doctor will do and what the eye bank will do. So that's the problem. Another problem with that it has to be done by relevant people. But in other countries, like I know in Sri Lanka, in America, in Iran, they are doing it themselves. So it's the independent bodies who do it.
Thank you very much.
Professor Mazhar, Qayyum, you have to say.
Well, I must congratulate the lady who presented about the Pakistan Foundation Fighting Blindness. But during your presentation, you mentioned the history and the research project of the foundation. Well, for your knowledge, my name is Dr. Mazhar Qayyum, and I have been associated with this foundation for quite some time. About history, it was founded by two persons. One you have mentioned, the otherwise Dr. Bashir Chauhan, who was the founder president of this branch of society also, and has been our patron for a long time. So I would like that his name must be added to that. And he was also the chairman of the research committee in that foundation for a number of years, maybe for 20 years. After that, myself and General Mazhar, we were heading the committee. And now I know that it's Dr. Shkeb, who is also an active member of our society, is heading that. So I would like that when you give your presentation, at least Dr. Bashir Chauhan's name must be there. Thank you.
Thank you, sir. We're running out of time, but okay. I would request Professor Zia Ul Islam, Saab, chair of the session.
I think I shouldn't talk much more because we are already short of time. I think this symposium was really, all the presentation were really very informative, and we should also think about it. And regarding this HOTA, and I think the Ophthalmological Society of Pakistan is the president. I think they should take this on the federal level, and once it's changed on the federal level, the provincial will follow it. So with this, we would like just to close this session, and thank you very much for all of your attendance.
Thank you, sir. Would you please like to come off stage, down in front of the stage for the shield distribution? You, sir. I would request Professor Sana Ullah Jan to please come forward and take his shield. Professor Tayyab Gul Malik. Professor Tayyab. Colonel Maeirah Shafique. Miss Rabail Peerzada. Professor Zia Ul Islam Saab, sir. Professor Mehfooz Hussain, last but not least. So I would now hand over the mic to Colonel Shehzad.
Thank you very much, sir. I thank you for the moderation. As a tradition, every year OSP Federal has a tradition of giving Lieutenant General Jahandat Khan Gold Medal to ophthalmologists who selflessly have given whole their lives in eradication of blindness in Pakistan. For this year's medal, I would request Professor Mazhar Qayyum to read the citation for the recipient. Professor Mazhar Qayyum, sir.
Bismillahir Rahmanir Rahim. It's an honor to read the citation for a very dedicated person who is being awarded this medal. This medal is awarded in the memory of Lieutenant General Jahandat Khan, who was the founder chairman of the Al-Shifa Trust. Al-Shifa Trust is providing state-of-art ophthalmic services to patients of all classes through the main hospital at Rawalpindi and satellite hospitals at Sakkar, Kohat and Muzaffarabad. Al-Shifa Trust is also running the Pakistan Institute of Ophthalmology. This is probably the biggest ophthalmic training center in Pakistan, and a large number of doctors and paramedical staff have been trained and awarded fellowships and diplomas, and they are serving all over the country. Now, this year, the General Jahandat Gold Medal is being awarded to a living legend, Dr. Mukhtar Ahmed. Dr. Mukhtar Ahmed is a graduate of Nishtar Medical College and holds fellowships from UK and Pakistan. He came to Pakistan in 1974 and established in Karachi. With his arrival, began a new era in ophthalmology in Pakistan, in which vitreoretina starts to get importance. He was a trained retinal surgeon, and he has been instrumental in establishing 4 major retina units in different hospitals in Pakistan. First, at Spencer's Eye Hospital, Karachi, the Adamji Foundation Retina Clinic. Secondly, he served at Liaquat National Hospital, Karachi, where he worked as an honorary surgeon from 1980 to 90, 10 years. The third is at Al-Shifa Trust Eye Hospital, Rawalpindi. Here also he provided honorary services and not only operated patients, but also trained a number of doctors. He worked here from beginning of the hospital to 2004. Fourth, he has established Elza Retina Foundation Organization, in short called ERVO, and this is the only retina-specific NGO providing services at Karachi and Nawab Shah. At Nawab Shah, he established a hospital which is providing free services to large number of patients, and even at this age of 85, Dr. Mukhtar travels to Nawab Shah every week and holds clinic over there. He has done thousands of surgeries in numerous eye camps in different parts of Pakistan. He has always been among the pioneers in introducing advanced diagnostic and surgical techniques in vitreoretina, like FFA, OCT, wide field device vitreoretinal surgery, micropulse diode laser, and others also. He has been awarded numerous awards and medals, including Norman Christie Gold Medal and the President Pride of Performance Award. He was the first ophthalmologist to receive this award. During his very long and active professional career, he has been known not only for his professional skills, but also for his ethical practices. We have been talking about ethics for the last 1 hour, and Dr. Mukhtar chairs the ethical committee of OSP since 1996. Thank you very much.
Thank you very much, sir. I would request President OSP Federal, Professor Tayyab Gul to come forward, sir. President OSP Center, General Mazhar, and our chief guest, Lieutenant General Retired Mustafa Kamal Akbar. Now I would request Dr. Mukhtar Ahmed to please come forward and receive his medal. Thank you very much, sir. Two announcements. One, we have shifted our inauguration, which was supposed to be held now, to 1 o'clock tomorrow, because this conference is being co-held by OSP Federal and OSP Quetta, and unfortunately the delegates from Quetta couldn't reach in time. They are on their way now. Secondly, from here we'll move for dinner to Chinar Golf Club. जो लोग वॉक कर सकते हैं तो पार्किंग के बीच में से रास्ता है, उस पे आ जाएं. बाकी बाहर कोस्टर्स वगैरह भी होंगी, जो उस पे आना चाहें वो उस पे आ जाइए. तो यहाँ से हम अभी डिनर के लिए चलेंगे जी. बहुत शुक्रिया, थैंक यू जी.